Welcome to this tutorial on how to insert a nasogastric tube. In this video, we will walk you through a scenario with a simulated patient. We will cover materials, preparation, and tube insertion. You will need gloves, a syringe, an appropriately sized NG tube, pH strips, steri strips or tape, Tegaderm film, silicone-based lubricating spray. Note that on a real patient, you would use viscous lidocaine, which also acts as an anesthetic. Hi, my name is Adam. I'm a third-year medical student. What's your name?
Jim.
Hi, Jim. And when's your birthday?
January 6th, 1985.
Great. Today we need to insert a nasogastric tube. This will involve me putting a flexible tube through your nose directly into your stomach. It might be a little uncomfortable, but it shouldn't be too painful. Is that alright with you?
Yes.
Great. I'm going to be using some local anesthetic to make sure the procedure is as comfortable as possible. Have you ever been allergic to local anesthetic?
No.
Okay, let's begin. Don non-sterile gloves. Position the patient upright in the sniffing position, with her neck flexed and chin up. Prepare and arrange all the equipment you will need for the procedure on a table within arm's reach of the patient. To estimate the proper depth of tube insertion, place the end of the tube at the patient's nose and measure the distance from the nose to the ear down to the xiphisternum. Make note of this point using the number markings on the tube. You may also mark this point with tape or a marker. To choose the appropriate nostril for tube insertion, ask the patient to inhale through one nostril while occluding the other with their finger. The nostril that provides superior flow should be the one through which the tube is inserted. Lubricate the tip of the NG tube. On a live patient, you would use viscous lidocaine. However, for this simulation, we will be using a silicone-based lubricant. Insert the lubricated end of the tube into the nasal cavity. Ensure that you aim the tube posteriorly and toward the floor of the nasal canal. Never aim the tube upwards, as this may result in the tube traveling intracranially. Continue passing the tube slowly into the oropharynx. At some point, the patient may gag. You may also feel some resistance as the tube enters the laryngeal apparatus. If so, stop advancing the tube. Instruct the patient to take small sips of water through a straw. Advance the tube slightly each time the patient swallows. You should feel less resistance once you pass the larynx. Continue to advance the tube until you reach the appropriate depth. Use tape to secure the tube to the patient's nose. Apply one half of the steri strip to the patient's nose, and wrap the remaining half around the tube. Repeat this with the second steri strip, wrapping around the tube in the opposite direction. Finally, place the tube around the patient's ear. Using Tegaderm film, attach the tube to the patient's cheek. Ensure that there is no tension being put on the tube. Connect the end of the nasogastric tube to a syringe. Aspirate a small amount of gastric contents. In order to confirm that you have correctly placed the tube, use a pH strip to measure the acidity of the aspirate. A pH less than 5 usually indicates correct placement. Note that a higher pH may be appropriately detected if the patient is on a proton pump inhibitor. If in doubt, a chest X-ray should be ordered to confirm proper tube placement.